roughly 8% of Americans suffer from PTSD. That amounts to roughly 25.4 million Americans each year. According to the article, Mind-Altering Drugs Can Cure PTSD, written by Gills in 2016. Good afternoon, my name is Van. So MDMA is becoming a more viable option for the treatment of PTSD with every clinical trial. And it can now be seen as potentially an even more promising and a more effective treatment method than current options. So PTSD is otherwise known as post-traumatic stress disorder, and it can result from exposure, either directly or indirectly, to traumatic and usually life-threatening experiences such as military combat or sexual assault. And those symptoms can manifest themselves in a whole myriad of ways, anything from anxiety and depression to suicidal thoughts. We're treating PTSD currently with therapy, hypnosis, anti-anxiety medications, and antidepressants, and usually a combination of 2, 3, or even more of these. Some of the problems, particularly with the medications, is that they need to be taken every day, and they're highly addictive. They also can be seen as are seen as a band-aid rather than a cure. Some of the other problems is that they're met with mediocre success. And what that means is, of the people who are doing current treatment options, whether that's therapy or medication, is that they are roughly only 25% successful in reducing any of the PTSD symptoms, really. And that leaves medical professionals, doctors, scientists, anyone that's really invested in this, wanting to revisit things like MDMA in the treatment of and possibly even curing of PTSD. So what MDMA does is it releases serotonin, dopamine, and oxytocin into the brain. And those decrease fear, enhance communication, and promote deep introspection. And this is really important during the therapy and healing process. So basically what the patient does is they're dosed with MDMA, which can last anywhere from 3 to 6 hours. And during that time, they are undergoing intense therapy sessions. In the article, The Agony and the Ecstasy, written by Macmillan in 2015, one such patient, Roxanne Murphy, details her accounts of when she developed PTSD. So she developed PTSD after witnessing the death of her husband when he got hit by a car. And she experienced the typical symptoms of PTSD: suicidal thoughts, anxiety, depression. And after the first few cycles, the first few MDMA-assisted therapy sessions, she experienced a dramatic improvement in her sleep. All of her flashbacks, all of her suicidal thoughts were completely removed, completely went away. And this is not atypical. This is actually really typical of the patients that have gone through these clinical trials. And a matter of fact, they have seen an 83% success rate. So what that means is 83% of the patients who have gone through clinical trials have received 80% or more improvement of their PTSD symptoms. And a lot of those patients have actually gone on to say that they were essentially cured of PTSD. So considering the high success rate of MDMA, it seems, as I mentioned, to be an even more promising and perhaps an even more effective treatment for PTSD over current treatment methods. So with continued overwhelming success in the clinical trials, this has also opened the door for research of hallucinogens as treatments to other ailments, such as anxiety, addiction, and autism. Thank you.